The anatomy and pathology of a disc herniation include the nucleus propulsus and the annular fibers. A herniation is the protrusion of the nucleus propulsus through the annular fibers. The vertebral body is surrounded by the ALL anteriorly and the PLL posteriorly. When the herniation protrudes through the ligaments, particularly posterior, it protrudes into the spinal canal and can compress the spinal cord or nerve root, causing symptoms. Herniations can be broad or focal. Broad? Can you see me still?
I don't know. Wait.
Yeah.
Oh.
Yeah, you're good.
Yeah, you're golden.
Okay. Herniations can be broad or focal. Broader when the herniations are greater than 25% of the area of the disc. Focal is when the herniation is less than 25% of the disc area. Protrusion is when the herniation's base is wider than the distance it extends into the spinal canal. Extrusion is when the herniation extends further into the canal than the width of the base. Contained herniations have not ruptured through the annular fibers, and uncontained have broken through. Schmorl's nodes, when seen on X-ray, are an indication of a herniation that has gone superior or inferior rather than anterior, posterior, or lateral. Signs and symptoms are radiating pain and weakness. Bilateral symptoms indicate a nerve root lesion, and unilateral symptoms indicate a nerve root lesion. Symptoms are dependent on the level of the herniation. A herniation at the level of C5 and C4 will produce a weakness of the deltoid and anterior wrist flexors. A herniation at C5 and C6 will produce weakness of the biceps and wrist extensors. A herniation at C6 and C7 will produce weakness of the triceps and the finger extensor muscles. Herniation at C7 and T1 produce weakness of hand grip. Causes are trauma or posture, which are progressive unless posture is corrected. The most common age for a herniation is 30 to 50 years old. After 50 years old, the disc begins to degenerate, and pain is most likely due to joint degeneration. Testing for herniations would start with orthopedic tests. Jackson's compression is the primary test. It includes having the patient seated, laterally flexing the head, and putting pressure down and down on both sides. And we're looking for reproduction of pain or symptoms. Other tests to confirm a herniation or other space-occupying lesions are Naff-Zeders and Lhermitte's. Shoulder decompression would indicate a nerve root lesion. After the orthos, an X-ray can show a loss of disc space, and MRI can show soft tissue changes, and you can see the actual herniation. Treatment includes adjustments, soft tissue work including stretching, exercise, or mobilization, and postural exercises to help centrate the joints and avoid progression of the herniation.